Welcome to study session 8, Antenatal Screening Test and Physical Examination of a Pregnant Woman. Introduction. After learning about antenatal booking and care, you will be learning about the various antenatal screening tests. There are many tests that are done in the antenatal. As a midwife, you should also know how to perform physical examination of a pregnant woman. In this study session, you will learn about the screening test carried out during booking and/or subsequent antenatal care visits and the main purpose of physical examination of a pregnant woman. It will also discuss the reason for the screening test as well as explaining the difference between the screening test and diagnostic test. This study session will end by outlining the roles of a midwife in screening tests and how you can do detailed abdominal examination for a pregnant woman. Learning outcomes. When you have studied this session, you should be able to 1. Discuss the reasons for antenatal screening tests. 2. Highlight the various laboratory screening tests. 3. Discuss the meaning of physical examination of a pregnant woman. 4. Highlight the various processes involved in the abdominal examination of a pregnant woman. Reason for antenatal screening tests. You do screening tests in order to ascertain normalcy. A number of tests are suggested by you as a midwife for all pregnant women as part of routine prenatal care. These tests can help find conditions that can increase the risk for the mother or the fetus. Screening test. The following tests are done early in pregnancy. Complete blood count, CBC. A CBC counts the number of different types of cells that makes up your blood. The number of red blood cells can show a certain type of anemia. The number of white blood cells shows how many disease-fighting cells are in the blood. And the number of platelets can reveal any problem with the blood clotting. Blood type. Results from the blood type can show you whether your client has rhesus factor. The Rh factor is a protein that can be present on the surface of the red blood cells. Most people have the rhesus factor, therefore they are rhesus positive. Others do not have rhesus factor, therefore they are rhesus negative. If the fetus is rhesus positive and the mother is rhesus negative, the mother's body can make antibodies against the rhesus factor. In a future pregnancy, these antibodies can damage the fetus' red blood cells. Urinalysis. You will test the urine sample for glucose. High level might be indicative of diabetes mellitus. You will also test the urine for protein, and if present, the amount should be measured. The presence of protein in the urine might be indicative of preeclampsia. You can also do urine culture tests for bacteria, and if present, this can be a sign of urinary tract infection. Rubella test. Rubella, sometimes called German measles, can cause birth defects if a woman is infected during pregnancy. You might need to initiate your client's blood test to check whether she has had past infection with rubella or if she has been vaccinated against this disease. If she has not had rubella previously, or if she has not been vaccinated against the disease, you should educate her on the importance of avoiding contact with any infected person while pregnant because this disease is highly contagious. If your client has not been vaccinated, she should not be vaccinated while she is pregnant. Hence, she should get the vaccine after delivery of her baby, even if she is breastfeeding. Sexually transmitted disease (STD) test. All pregnant women are tested for syphilis and chlamydia early in pregnancy. Syphilis and chlamydia can cause complications for both mother and fetus. Therefore, your client should be treated if infected with any of these STDs. Also, if your client has risk factor for gonorrhea, she will be tested for STD. Your client should also be tested for human immunodeficiency virus after you have gained our informed consent. If a pregnant woman is infected with HIV, there is chance of passing the virus to her baby. A pregnant woman infected with HIV can be given medications. You can also educate her on other steps to take in order to reduce the risk of passing the virus to her baby. Hepatitis test. All pregnant women are tested for hepatitis B virus. If your client has risk factors, she may also be tested for hepatitis C virus. You need to educate your clients that any pregnant woman infected with hepatitis B or hepatitis C can pass the virus to her babies. The following tests are to be done later in pregnancy. Repeat complete blood count. Rhesus antibody test. If your client is rhesus negative, her blood should be tested for rhesus antibodies between 28 weeks and 29 weeks of pregnancy. If she does not have rhesus antibodies, she will receive rhesus immunoglobulin. This will prevent her from making antibodies for the rest of her pregnancies. If she has antibodies, she may need special care. Glucose screening test. This test measures the level of glucose, sugar in the blood. A high glucose level may be a sign of gestational diabetes. This test is usually done between 24 weeks and 28 weeks of pregnancy. If your client has risk factors for diabetes or had gestational diabetes in previous pregnancy, the test can be done during the first trimester. Group B streptococci test. GBS is a type of bacteria that lives in the vagina and rectum. GBS can be passed to a baby during birth, and many women carrying GBS do not have any symptom. Most babies who get GBS do not have any problem. However, few of them become ill. The illness can cause serious health problems or even death in newborn babies. To detect GBS during routine screening tests, a swab is used to take samples from the vagina and rectum between 35 weeks and 37 weeks of pregnancy. If your client's GBS test result is positive, you will need to discuss the result with our obstetrician, who will prescribe antibodies to be administered during labor to help prevent the baby from being infected. Difference between screening tests and diagnostic tests for birth defects. Screening tests are done during pregnancy to assess the risk of the fetus to certain common birth defects. A screening test cannot tell whether the baby actually has a birth defect. There is no risk associating with screening tests. Screening for birth defects begins by assessing your client's risk factors while taking midwife's history. Diagnostic tests can actually detect many, but not all, birth defects caused by a defect in a gene or chromosomes. Some diagnostic tests are associated with some risk, including a small risk of pregnancy loss. Roles of a midwife in screening tests. Your roles as a midwife as regarding screening tests include: you should explain the need to have the screening test done to your client. You should carry out the screening procedures like checking the height, the weight, and the blood pressure of your client. You should advocate and initiate tests for your client. You should be able to interpret the test results to your client. You should keep adequate record of your client's results for proper monitoring, such as the urinalysis result, the blood pressure, and the weight. Meaning of physical examination of a pregnant woman. Physical examination of a pregnant woman is the assessment of a pregnant woman from head to toe, with emphasis on the abdomen, in order to have an idea of the general state of health of the woman and the fetus. A midwife must possess the skill of assessment or examination of a pregnant woman to be able to detect any abnormality early enough during pregnancy. Objectives of physical examination of a pregnant woman. You should be able to achieve the following objectives while conducting physical examination on a pregnant woman: to observe for signs of pregnancy, to assess the health of the woman, to assess the fetal size and monitor its growth, to detect any risk factor to either the mother or the fetus, to detect any deviation from normal. For the purpose of this class, the physical examination of a pregnant woman shall be divided into two: physical examination of head to toe without the abdomen, physical examination of the abdomen. Abdominal examination of a pregnant woman. Abdominal examination of a pregnant woman is a systematic examination of the abdomen during pregnancy and labor. This is done step by step as follows: inspection, palpation, auscultation. Objectives. The following are the objectives of abdominal examination of a pregnant woman: to note the general contour of the abdomen, paying special attention to its shape and size, as well as presence of scar and fetal movement; to assess fundal height and determine the lie and presentation, relationship of presenting parts to the pelvic brim, and the condition of the fetus. Equipment and preparation. Cover sheet, fetal stethoscope, peanut stethoscope or Doppler device, tape measure, watch with second hand. Preparation. 1. Ask the client to empty bladder in 30 minutes before examination. This is to ensure closer accuracy because full bladder displaces uterus. 2. Explain the procedure to the client so as to allay her anxiety and to be able to get her cooperation. 3. Ask client to lie in dorsal position with her hands by her side on the couch or bed, with her head supported with one pillow. 4. Screen the bed so as to provide privacy. 5. Stand on the right side of the patient if you are a right-handed person. This will ensure easy access to the client. 6. Expose abdomen from pelvis to the sternum. 7. Wash your hands, then rub your palms together to generate heat. Touching your client with cold hands can induce contraction of the abdominal muscles and cause discomfort to your client. Inspection. Observe for any damage to the skin integrity aside from stretch marks such as the linea nigra and the striae gravidarum. Observe the abdomen for presence of linea nigra, striae gravidarum, and scar. Observe the size, shape, and contour. Note that multiple pregnancy or polyhydramnios will enlarge both in length and breadth of the uterus, while a large baby increases only the length. The shape is longer than breadth in longitudinal line, as it occurs in 99.5% of cases. If transverse, the uterus is low and broad. Observe for a saucer-like depression below the umbilicus, which is a sign of occipital-posterior position. Observe for fetal movement. This is an evidence of a live fetus. Lateral palpation. Still facing your client, place your hands on both sides of the abdomen and palpate the fundus. Use the parts of your fingers. If the gestation is 36 weeks and over, then begin to palpate from the pelvic region upwards. Continue down on both sides of the uterus. You may also steady the uterus with one hand. Use a rotary movement of the opposite hand to map out the back as a continuous, smooth, resistant mass. On the other side, the same movement reveals the limbs as small parts that slip about under the examining fingers. Pelvic palpation. Palpate the lower pole of the uterus, just above the pelvis, and this should not cause discomfort to the woman. Turn to face the client's feet. Tell the client to take a deep breath, and on expiration, use both hands to palpate the lower abdomen. Face your client. Use your right hand to grasp the lower pole of the uterus gently, while the left hand steadies the uterus. This is to determine the presentation of the fetus and engagement of the head. You can balance the head between the fingertips of the two hands because of the free movement of the neck. Auscultation. Place your penile-footal stethoscope on the mother's abdomen at right angle to it. Then place your ear firmly in close contact with the stethoscope, but your hand should not touch it while listening. This is to avoid extraneous sounds. You can move the stethoscope until the point of maximum intensity is located, where the fetal heart can be heard most clearly. It is like the ticking of a clock under a pillow. Use your watch with second hand to count the fetal heart rate for 1 minute and compare with maternal pulse. This is to ensure that you are not taking the maternal pulse for the fetal heart rate. The fetal heart sound is usually more rapid than the maternal pulse. You can also use digital Doppler device to count the fetal heart rate.